Greetings from Annoor Dental College and Hospital, and a warm good morning to one and all. Welcoming to this exclusive online conference and wishing everyone a very happy International Women's Day. Myself, Dr. Pooja Latti, I'm here today to take a session on oral health revolution, navigating the transformative landscape in Indian dentistry. My session will be covering the following headings: the changing trends in oral health and disease, the trends in disease risk factors, dental manpower, the changing face of dental education in India, the current dental practices or the modern dental practices, and lastly, I'll be talking regarding the SWOT analysis of dentistry in India. Oral health is defined by World Health Organization as a state of being free from mouth and facial pain, oral and throat cancer, oral infection and sores, periodontal disease, tooth decay, tooth loss, and other diseases and disorders that limit an individual's capacity in biting, chewing, speaking, and psychological well-being. And all the oral diseases are subjective in nature and they're not static, but they are dynamic. If you look at the alarming status of oral diseases in the globe, dental caries is considered to be the most prevalent of among the 291 disease conditions studied in the globe. And severe periodontitis is the sixth most prevalent condition. 50% of 35 million HIV cases report with oral infections. 50% of 8.5 million trauma deaths annually occur due to orocraniofacial trauma. And head and neck cancer accounts for 30% of all cancer cases, that is in India. And 1 in 33 males and 1 in 107 females are at risk of developing head and neck cancer in India, which is quite an alarming statistics if you look at. And this picture shows, or this graph shows the WHO estimate, and it estimates that globally close to 3.5 billion people suffer from one or the other form of oral diseases throughout the world. And it is alarming again to see that India leads with the highest caseloads of oral diseases in the globe, with 632 million cases reported. And if you see the geographical distribution of the oral diseases across various countries, Southeast Asian and Western Pacific countries have the highest caseloads of oral diseases. And if you look at this table, it can be seen that India carries the highest oral disease caseload with respect to dental caries, both in permanent and deciduous dentition, regarding to severe periodontal disease and oral cancer, where India ranks the highest. And for edentalism, India comes second, following China. So why there is so much of geographical variation of oral diseases? Mainly, it could be due to inadequate exposure to fluoride, maybe in the water supply, and availability of oral hygiene products containing fluoride like toothpaste, and availability and affordability of foods with high sugar content and poor access to oral health care and services in the community. It can also be because of marketing of food and beverages high in sugar, as well as tobacco and alcohol, which has led to growing consumption of such products, which contribute to majority of the oral health conditions as well as non-communicable diseases. And oral diseases are hidden or invisible, and usually it is accepted as unavoidable consequences of aging and life, which is a sad fact. If we try to explain the oral diseases in the community, we can look at this iceberg phenomenon of disease, wherein the tip of the iceberg constitutes the visible cases, that is, those cases which report to the hospitals or clinics and get themselves diagnosed. But the majority of the disease burden lies below the watermark, that is the hidden part of the iceberg, which constitutes the majority burden of the diseases, which usually are invisible due to either they may be misdiagnosed cases, undiagnosed cases, or subclinical cases, or symptomatic or unidentified cases. And the main challenge remains in identifying this hidden burden of disease so that we could tackle the oral health issues throughout the globe. Now let us look at the changing trends in disease risk factor, or the common risk factors which are shared between oral diseases and other diseases. Oral diseases, as we all know, are multifactorial in origin, and they are also non-communicable diseases. And the major risk factors which are responsible for the oral diseases are tobacco consumption, both in smoking and smokeless form, alcohol consumption, consuming diet which is high in sugar, a poor oral hygiene, and stress. These factors are also common risk factors for major non-communicable diseases like cardiovascular diseases, cancer, chronic respiratory disease, and diabetes as well. So, and both these oral diseases and the other non-communicable diseases are diseases of modern civilization and are mainly mediated by lifestyle transitions. So if we need to tackle both these conditions, both the oral diseases and the most prevalent non-communicable diseases, we have to adopt an approach which can help us to tackle both the diseases at the same time. This approach is called as common risk factor approach, wherein it is a method that aims to control risk factors for both oral diseases and other non-communicable diseases. And risk factor modification is the best preventive strategy which can be adopted for both oral diseases and non-communicable diseases. The strategies which can be adopted to control these diseases are having a balanced diet, encouraging people to consume more of water and not other aerated drinks or fruit juices, avoiding alcohol and tobacco, using protective wear during playtime or during cycling or biking to avoid the craniofacial injuries, and lastly, maintenance of good oral hygiene. Let us look at the dental manpower status in India. If we look at the current statistics of the registered number of dentists in the Dental Council of India site, currently there are 3,21,550 dentists registered in the site, and around 323 dental colleges offer BDS course. This is the admission rate for the last year BDS course. We can see that there has been a lapse of around 4,000 or 3,000 seats in the last year admissions for both BDS and MDS as well. There has been lapse of some 5,000 seats. And this can be maybe because people believe that there is the scope for dentistry is reducing in Indian scenario. But let me clarify that by discussing few points regarding this dentist population in India. So the dentist population ratio in India is basically calculated using the actual population and the dentists registered in the Dental Council of India site. And the current population of India is 1.4 billion. And according to the World Health Organization, an ideal dentist population ratio is supposed to be 1:7,500. That is one dentist for catering to 7,500 population. But it is really alarming to see that only 10% of dentists serve in rural areas, which make up to 65% of the population in India. And the dentist population ratio in the rural scenario ranges from 1:30,000 to 1:1 lakh, which is way beyond the ideal dentist population ratio, which is proposed by WHO. But that the opposite is seen in the urban scenario. In an urban scenario, the dentist population ratio averages to around 1:4,000. That is way below the ideal dentist population ratio. These are some of the dentist population ratio across various Indian states. The states which have got the least dentist population ratio are Delhi, Goa, Karnataka, and Andhra Pradesh. The states with dentist population ratio 1:3,000 to 1:4,000 are Maharashtra, Himachal Pradesh, Haryana, Jammu Kashmir, and Tamil Nadu. The states which have got a moderate ratio are Kerala, Arunachal Pradesh, Manipur, Chhattisgarh, Uttarakhand, and Madhya Pradesh, where the dentist population ratio is 1:5,000 to 1:10,000. And the states where the dentist population ratio is way beyond are Rajasthan, Uttar Pradesh, Assam, Bihar, Sikkim, West Bengal, Puducherry, Tripura, and Orissa, where it ranges from 1:12,000 to 1:25,000. And all this dentist population ratio is representative of urban population. But I would like to say that this calculated dentist population ratio has certain drawbacks because, as I already said, this is calculated using the actual population at that point of time and the number of dentists registered at that point of time. And that makes it more unreliable and underestimated because the number of registered dentists that we see on the Dental Council of India site includes the practicing dentist, non-practicing dentist, retired dentists, deceased dentists, as well as dentists who have migrated to different countries. It does not include all these exclusions which have to be made, and all those people who do not practice are not excluded from that list. So when we calculate this dentist population ratio using those statistics, it becomes quite unreliable, and it doesn't represent the actual dental workforce in India. And thus, if you look at the oral disease burden in India, it is quite large, and it is going to increase day by day over a period of time. And the dental manpower in India is not sufficient enough to tackle this huge oral burden of disease. So there is more scope for dentistry in India because the burden of disease is going to rise, and as we already saw that the admission rate is coming down, which again makes a quite an imbalance between the disease burden and the dental manpower in India. Now let's see what is happening in the field of dental education in India. Dental education has not been reformed over a long period of time, but when the new NEP was introduced, a lot of changes came up, and this is the progress in the training capacity that has been happening in our country. In the past 10 years itself, there are 22 new colleges which have come up. And currently, the dental education system is going to have a huge reform or changes seen in the coming years, mainly because of the uh, National Education Policy, which is released in 2020. In accordance to that, a National Dental Commission Act was passed in 2023, and a National Dental Commission is going to be formed, which is going to soon replace the current Dental Council of India, as in lines with the National Medical Council. And a new BDS curriculum is going to be introduced for the BDS. And the basic salient features of this new curriculum include the course will be spread on a duration of 5.5 years. And it will be a semester system wherein the student has to complete 9 semesters. And the gradation will be credit-based system. And they have to complete 24 core courses spread over this period of 5.5 years in 9 semesters. And also there are compulsory 6 elective courses which the student has to undertake to complete the dental graduation course. So the elective courses are categorized into 6 categories. First is alternative dentistry. Then there is advanced clinical training, research, ethics and professionalism, biomedical science, and clinic administration. So one per head is mandatory, 1 elective course, and total 9 elective courses the student has to complete before they graduate as a dental uh, graduate in our country. So this new curriculum will be of international standards with credit-based system, which may allow for international exchange of students, and also credit transfer is possible in the future. And this change BDS or dental education will open doors for highly lucrative career, which will help students learn better and which will help them get absorbed in job market easily with advanced clinical learning of clinical as well as research skills. So next, let us look at the changing phases of dental practice. Lot of advances we see in change in the dental practice in all the specialties of dentistry. Let it be regarding the diagnostic parts, like there is oral scan, then there's T-scan, CBCT, then nanotechnology, robotic dentistry, artificial intelligence, painless dentistry, smart restorations, teledentistry, endodontic microscopes, minimally invasive dentistry, implants, and so on. There's a lot of advances happening in dentistry and dental field, and it is our responsibility that we keep abreast with all these technologies so that we can implement that and tackle the oral disease burden. Now, coming to the last part of the session, that is SWOT analysis of the dentistry in India. SWOT analysis mainly includes the strengths, weaknesses, opportunities, and challenges that we face regarding dentistry. So let me begin first with starting with the strengths. The strengths include we have a already organized healthcare delivery system, which is divided into public and private sector. And if an dentist gets incorporated into the public sector, it is going to ease the burden of oral diseases in India. Then already I've spoken about the healthy dentist population ratio. Especially in rural areas, we really lag behind as compared to the ideal dentist population ratio. So there is scope for dentistry and dental practice. Then there is also availability of dental auxiliaries like dental hygienists and lab technicians in our country who can also be effectively utilized for tackling the oral diseases. And a lot of technological advances are happening, and also there is a huge reform taking place with respect to dental education. Weaknesses include geographical divide of dentists, affordability of dental treatments in our country because the patient has to pay from their own pocket for the dental treatments. That is one of the major weakness. Limited government dental colleges giving free services, meager financial allocation for oral health from the government side, as the GDP which is allocated for the health is quite less, and for oral health there's no separate GDP allocated. And lastly, low perceived need for oral care by the population. The opportunities include the National Oral Health Policy, which is going to be implemented across all the states. Dental insurance, which is again coming up. Most of the insurance companies are currently providing insurance to dental diseases. Effective utilization of dental teaching institutions for oral health promotions. Enhancing community participation and reorientation of dental services by adopting villages and schools and thus improving the oral health of those population and increase life expectancy. And lastly, the challenges include low priority of oral health and health system, rising burden of oral diseases, low oral health seeking behavior, compartmentalization of oral health, where an oral health is not seen along with general health, but it is segregated from general health. And that is a major challenge for us to include that with general health as well. Lack of political will, presence of quackery, and lack of oral diseases data. So there's lack of the research which shows us what is the actual oral disease burden in India. If that is known, it will be easy for us to plan and implement programs to tackle the oral disease problems. So that ends with this SWOT analysis of the session. So let me conclude today's session and by saying that the field of dentistry in India is really experiencing a remarkable revolution, which is driven by technological advancements, evolving pattern of oral diseases, and the major dental educational reforms. And focus is mainly on preventive care and public health initiatives. So it is essential for us to stay informed and embrace this oral health revolution with enthusiasm and commitment, working together to create a future where every smile is a reflection of good oral health and a better quality of life for all. And this is the last one where I thought I could just share that a dentist is can not just be a clinician, but they can assume various other roles and thus help the community or the population to achieve good oral health. So first role is, I already said, you can be a clinician, you can also be a counselor, you can also assume the role of an educator and create awareness among the population. You can be a role model yourself in the community, and you can also undertake research. You can be an academician, you can be an entrepreneur, you can also be an opinion builder and an alliance builder as well. So the dentist just not be restricted to become a clinician, but there is a lot of variety of other opportunities which are available, and you can incorporate any of these roles and can also do multiple roles and thus be a successful dentist in our in this country. So that ends with my session. So coming to the end of my session, I thank you everyone for your patience listening, and this is my mail ID. If anybody has any queries or need to know anything more in detail, you're always free to contact me. Thank you one and all. Have a good day.